We're here at the Radboudumc University Medical Center, a teaching hospital in the Netherlands. And this is the place where patients come in order to get a diagnosis or a treatment. What we're currently seeing is that the range of technologies that are available for that purpose has become so vast, so wide. The question is, what do those technologies do? What impact do those technologies have? So the questions that are currently being asked in the context of health technology assessment are usually the sort of questions related to safety, to effectiveness, and then a range of other issues that are usually called ELSI, the ethical, legal, and social implications of technology. When we make this distinction, you're basically saying we have a number of facts, safety and effectiveness, and we have a number of value issues. According to the validate approach, we say those facts also have a very clear value dimension. And the values, on the other hand, have a clear factual dimension as well. So there's always a value dimension, which basically tells us what are the sort of things that you want to know about and that you want to investigate further. Now, in current practice of HTA, it's primarily the expert who produces specific knowledge on the technology. In the validate approach, the emphasis is much more on learning among the various stakeholders, trying to see the technology from another perspective and trying to acknowledge the relevance of the aspects that then come into view. So then you also, as an HTA researcher, have a different role. You also try to facilitate or foster learning among the various stakeholders so that there is wider agreement on what is it exactly that we want to know about this technology and what seems to be relevant in order to make accountable decisions. HTA is in fact a type of policy research. It aims to support decision-making on the development and use of health technologies. However, there are many problems, policy problems, that are ill-structured, where there is no such agreement among stakeholders. In such cases, it's not useful, not helpful, or even inappropriate to conduct a cost-benefit analysis. Rather, you would want to conduct a normative inquiry in order to clarify the values that are at stake. So what you learn is what sort of problem are we currently dealing with? Secondly, you will learn what type of policy analysis is appropriate given the sort of problem that we are currently dealing with. And you will learn to use a number of methods, including the inquiry into values, specifying norms, etc., so that empirical analysis and normative inquiry are really integrated and are always a necessary element of any HTA that you will conduct.